the patient's still having symptoms, what kind of medications do you start organizing for acid that's coming up?
There are 3 medicines we use for reflux. We have the quick fix that only works short term. We call those antacids, Gaviscon, Tums, Rolaids. The next step up are the H2 blockers like Pepcid, Zantac. Those work quick, about 20 minutes, but last about 12 hours. They're not as strong, though, as the big gun. That would be the proton pump inhibitors. That would be Prilosec, Nexium, Prevacid. They take a while to kick in, 2 or 3 hours to work, so they're not good for immediate relief, but they last for 24 hours.
So that's the big gun,
Yep.
the PPI, the proton pump inhibitor.
Correct.
How often do you have to go to that, or are there some, you want to stay away from the big gun? You want to use the H2 blockers? You want to use the antacids? Everybody's individualized.
It's all individualized because nobody wants to spend a month trying different medicines. They just want to feel better, Dr. Bob. So a lot of times we go to the strong stuff up front. If it's not too bad, we say, let's try the strong stuff. Let's get you really feeling well, get you on that weight loss program, then try to wean later on. It's just, once they're on the good stuff, sometimes you don't want to come off it because it works so well.
How do you take a proton pump inhibitor, something like omeprazole, Pepcid, any of those?
Well, the way those proton pump inhibitors work is that they kill off the acid pump. The acid pump isn't available to be killed when you're fasting. So what you have to do is you take your proton pump inhibitor about 20 or 30 minutes before a meal. It gets into your stomach, it gets absorbed, and for the next hour or 2, that proton pump inhibitor is circulating in your bloodstream. Then you eat, and by eating, the pumps come out, they start secreting the acid, and the omeprazole can knock them off irreversibly. And the only way you make more acid is if you make more pumps. That takes about 24 hours. So taking a proton pump inhibitor is important 20 or 30 minutes before a meal.
So you take it once a day, before each meal, morning and night?
Most people can take it once a day before the morning meal. If their main trouble is overnight acid exposure, we give it to them before supper. If people do need to take it twice a day, then they should take it 20 or 30 minutes before the morning and evening meal.
So you have to educate people about the time you take that pill and you don't eat for another 30 to 40 minutes. Then the pump comes out and it's able to be blocked.
Correct.
Now, if that's blocked, if the acid secreting cells are blocked, then you don't have as much acid in the stomach. Does that present problems? Certain medications, for instance, need a little bit of acid, this and that, so you have to weigh the pros and cons of everything.
Thyroid medicine sometimes interferes with that. Iron supplementation sometimes has to do with that. Therefore, please talk to your pharmacist and they can help you how to sort of space things out. But in the big picture, we try to keep people on them for a period of time to feel better, but there's always the try to get them down less. You know, there's all these side effects that are popping up. If you went to the computer and if you said side effects of PPI, you're going to get scared because it's going to say dementia, kidney disease, strokes, bone loss. The problem is none of that is proof. It's called case-controlled trials. And it's where researcher people are looking at groups of people and making assumptions, but life isn't about assumptions, it's about facts. And it's never really been shown that those pills cause all those side effects. But the big push is to have people on the less amount of pills if they can help it.
The less, the better, usually, from that standpoint. So how do you know if the patient is responding? Well, I feel better and I don't have the heartburn anymore.
Then I would say it's working. Great for you. Let's try to come down and maybe switch you this time to something less strong, Pepcid or Zantac. And if they fail, then at least they know that it's something. Reflux disease is a chronic condition. I wish it was like a sinus infection that you can give some antibiotics, but most reflux conditions are chronic. We don't cure thyroid, we don't cure hypertension, we don't cure high cholesterol. It's something you got to deal with routinely.
So the evaluation and the treatment of reflux is very effective, it's very good, but you have to continue to have follow-up and understanding of what's going on with the disease.
The harder thing is when you think it's acid reflux and you give them a stomach acid pill, and guess what? They don't get better. That's the hard part, that I think that's when you need help from a gastroenterologist or from your general doctor.
Yeah, and I think that's a key issue. If something's not working, there's got to be a reason.
Right.
And you need to work that out with your doctor.
Right.